Hello to all students. In this video lecture, we are going to discuss dehydration. Dehydration is the excessive loss of body fluids, especially water and electrolytes from human body. First of all, we are going to discuss some classification of dehydration. There are certain different types of classifications and there are different types of dehydration. Number one, mild dehydration. In this condition, there is a 5% loss of body fluids from the body and the symptoms are not very severe. The second type is moderate dehydration. In this condition, 10% body fluids along with electrolytes can be removed from the body. And in severe dehydration, 15% or more than 15% body fluids can be drained out from your body. This condition is very severe and can cause and can lead to many chronic conditions. Another type of dehydration is isotonic dehydration. In isotonic dehydration, there is a balanced loss of water and sodium. So both water and electrolytes, especially sodium, is removed from the body. This is usually happens when a person is suffering from diarrhea or vomiting due to the infection in the digestive system of human body. Another type is hypertonic dehydration. Hypertonic dehydration is a condition in which loss of more water than electrolytes like sodium. Such condition can arise due to the high fever, which can be caused by different medical conditions like cancer or other chronic conditions. The last type of dehydration is hypotonic dehydration. During hypotonic condition, there is a more loss of electrolytes, especially sodium, than water. This condition is known as hypotonic dehydration. This condition usually arises due to excessive intake of diuretic medicines, which are usually taken by patients which suffer from high blood pressure. So now we are going to discuss some important symptoms of dehydration. First of all, dryness in the mouth, which is a common symptom found in dehydrated person. Excessive thirst, decrease in sweating, decrease in urine production, headache, which is the most common cause of dehydration. Usually people take painkillers to relieve headache. Maybe this headache is due to dehydration, and by intaking certain amount of water and electrolytes can cure the headache instead of taking painkillers. So we must have to rehydrate our body in case of dehydration. Headache sometimes leads to dizziness, which can lead to weakness and then cramps in the legs and arms. So as dehydration progresses from mild to moderate and from moderate to severe, symptoms also get worse. Decrease in blood pressure and decrease in blood volume, low blood pressure, which leads into fainting. There is a harm to vital organs like brain, heart, kidneys, liver, etc. can suffer severe damage by dehydration, which can lead to convulsions. There is an increase in the nitrogenous wastes like urea, uric acid in the body, which can lead to convulsions, and then these convulsions can lead into coma. And especially infants and old people, this coma can lead towards death. So it is very important that we must rehydrate our body before it can damage significant damage to your body parts. So we know the causes. Most of the important causes are severe diarrhea and vomiting, which is due to infection in the gut or digestive system by bacterial or viral infection. So by treating antibiotics and rehydrating body this condition can be avoided. Excessive urine output during certain diseases like diabetes insipidus and diabetes mellitus can lead to dehydration. Insufficient intake of water, usually a person needs 1 liter to 3 liters of daily intake of water, but it depends on the age of the person and environmental condition. So you must take sufficient amount of water according to your conditions and age, so that your body can be kept rehydrated or hydrated. Prolonged physical activity in hot weather, when there is a more temperature outside and you are performing more physical activities, so make sure that you are rehydrating your body, because there is excess sweating can lead to dehydration. So excess sweating is also the main cause of dehydration. Use of laxative and diuretics. Laxatives are certain medications which are used in the constipation, while laxatives and diuretics are used in certain diseases like high blood pressure to remove the excessive amount of water from your body. So excessive use of these medicines can remove water and electrolytes from your body, which can lead to dehydration. What is the treatment? The only treatment is the hydrate your body, rehydrate your body. World Health Organization has recommended to take oral rehydration therapy. In this case, ORS, a certain liquid in the form which contain glucose, electrolytes and some water, can be taken orally to rehydrate your body. But this condition always does not work. But if the dehydration is more severe, then the person needs to go to emergency room, where intravenously ORS or certain electrolytes along with water can be injected through veins to rehydrate the body. But most important thing is that you must know your body, that the body is going to dehydrate in certain condition, and you keep rehydrating your body so that you can avoid the complications and damages to your body parts which can caused by dehydration. That's all for today.